All right, Mary, so I'm going to ask you the last couple of questions here. What do you think are the major unmet needs in primary care for detecting in a timely way and managing Alzheimer's disease? And how can healthcare providers in the front lines work best with specialists to really manage and provide this care to patients and families who are very deserving?
I think the first thing is education. Education on the part of the community so that family members and patients are aware that there are things we can do if we diagnose. And for the medical profession, I think there's still a lot of myths and misinformation that cognitive loss is a normal part of aging. There's nothing we can do about it. So I think what we've talked about in this program is that there's a tremendous amount that we can do. Perhaps we don't have the cure, but there are many things that we can do to provide improve cognitive performance, improve care for the caregiver, extension of quality of life, length of life, joy, and so I think there's a lot of education. I would say that's number one. And for the providers, we need to educate ourselves on cognitive health, what's normal, what's not, and when to refer. Each of us will have our own area of expertise, and as soon as we feel uncomfortable that this is, I'm not certain, I don't have diagnostic certainty that this is Alzheimer's disease. This has some atypical findings and I'm not exactly sure what it is. Having that team of providers, neuropsychologists, neurologists, neurology subspecialists, dementia specialists that we can turn to in each of our areas.
Great. Well, this has been incredibly informative, and before we completely end the discussion, I'd like to get some final thoughts from each of our panelists, maybe a clinical pearl about what you would do or think about. So I'll start with Mark.
We've seen the complexity of this disease, but everything starts with the patient. We need to put in the time to build a relationship with them, to focus on their strengths, because we're forming a partnership with them which extends over years. And the more we give that time and respect, the better that both patient and caregiver will do.
But you, Mary, clinical pearl for us?
I'll just reinforce the concept of the team. I think when we think of dementia, it seems overwhelming at times, but establishing your strong team where each of us play a part and we're all doing that patient-centered care.
Thank you. Brad?
One of my colleagues likes to say that there's unfortunately not a cure for Alzheimer's disease, frontotemporal dementia, or related diseases right now, but there is a cure for the isolation and loneliness that accompanies all of them for each patient and family. So I think there's the importance of the partnership with the medical provider and the team, which we always have to say, we're going to be with you for this journey, as Mary so well articulates. And we want to be proactive about how we approach this journey and help you think about issues that may occur. We hope they won't, but we should plan ahead and not just react to them when they inevitably do occur for some people. And then I think the empowerment of participation in research, even if it doesn't help the person who participates, is often very meaningful for patients and families. So connecting people with the trials and the research studies that fit with their interests and goals, I think, is fundamentally important, and there are more and more of those, as Mark says, that are accessible to people. And I think finally, helping people engage with the community that they're part of, in this case the Alzheimer's Association, but there are grassroots associations for all of these diseases, and connect and also advocate. We've seen tremendous increases in the federal funding for Alzheimer's and related disorders over the last 5 years, and that's a direct result of the advocacy of our patients and their families and the communities that we're talking about here. So we always try to touch on those points in relation to why it's important to make a diagnosis and some of the things that can be done to help empower the members of our community that are suffering with these diseases.
Thank you, Brad. Lily?
Yeah, I think really engendering hope is so important in both the patient and the caregiver, and giving them the tools they need and to really manage this disease process over time together, and kind of being that partner for them is really important.
That's right. message of hope and partnership and community, I think is really, really important. So thank you all for your contributions to this discussion. On behalf of our panel, we thank you for joining us, and we hope you found this peer exchange discussion to be useful and informative. Be well.